All right, well, sometimes in life, joint pain can play a huge role in slowing people down. But you know what? You do not have to live like that. The San Antonio Orthopedic Group can help. Dr. DeBerardino is joining us to give you some helpful information on maybe some insightful tips that can help you get to the next step. Good morning, sir.
Good morning, Esteban. Good to be with you.
Well, thank you for joining us. You know, there's some nationwide trend that is going on. You know, you got joint replacement, partials, full. You know, there's a lot of stuff going on, but let's kind of separate the two a little bit and kind of put some facts out there just to help everybody out.
Absolutely. So a total knee, everyone's akin to that. They might have a relative or a loved one that's had a total knee. And in this diagram, you can see a total knee is we replace the entire knee with metal and plastic. You get a new nice hinge that works great if you need it. But if you don't need it, if you're a little older than you or my age, I'm in my 50s, and I don't want a total knee. I just brought my mom home from total knees maybe, and I'm like, that's not me.
Yeah.
How about a partial knee? A partial knee only replaces the part that's bad.
Gotcha.
You feel like you still have your knee, and it is your knee, and it feels more normal.
Well, it also makes sense because why replace something if it's not broke?
Good adage.
All right. Well, you know, what is the difference between surgery in an outpatient facility versus the hospital? Because, you know, you are talking about recovery after this part.
Right. So outpatient surgery is kind of the way of the future. It's currently being done in great numbers. Every facility, every big hospital has an outpatient center, or there's true outpatient surgery centers that are standalone. And if you can be and safely do the surgery so the patients can tolerate it from a pain standpoint, from a functionality, I'd rather be in mild to moderate pain on my own couch with my remote than in a hospital bed.
So then there's some benefits that go along with this, and it's trending as well.
Yes, absolutely. There's a push nationwide to decrease hospital-acquired infections. And if you're in a surgery center in an outpatient surgery, you're not really in the hospital. You're not there overnight. You come in, get the procedure done, like this partial knee here,
okay,
and then you go home, and you come back just like you had your ACL reconstructed, which those kind of operations in the sports medicine realm are generally outpatient surgery now as well.
You know, what is the healing time on some of this, the outcomes that we, you know, encounter?
Well, we expect the same or better outcomes because there's potentially, and statistics are bearing this out, a decreased risk of infection, just as good of improvement. You're kind of already in the outpatient setting, living in your own house, doing your normal activities of daily living, maybe a little quicker, and you're not in the hospital overnight for multiple nights. You go home just like a knee arthroscopy, up to as soon as a couple hours right after surgery.
All right, good stuff. Well, let me give everybody the information so that way they know where to get some helpful information at. You got some of it. Now, if you want the rest and you're ready to take the next step, you need to give them a call, 210-804-5400. Stop living on the couch and get out. TSAOG.com for more information. They got 7 convenient locations, and if you got any questions, feel free to call, and they will help them out.
Absolutely.
All right, everyone. Doctor, thank you very much. Up next, forget